Okay, it's recording.
You just let me know what your name is before you get up there? Or when you get up?
Olive Williams.
Okay, whenever you're ready.
All right. Necessity not only authorizes but seems to require the measure. It is because we agree with President George Washington and wish to protect campus communities from additional hardships that we affirm the resolve all public colleges and universities should adopt COVID-19 vaccine mandates. Combining definitions from the CDC and Merriam-Webster, vaccine mandates are legal requirements imposed by communities to issue an official order requiring particular vaccines. The CDC defines vaccines as preparation that is used to simulate the body's immune response against diseases. The affirmative team believes COVID-19 vaccine mandates on all public colleges and universities will secure federal funding and protect students from excess financial burdens. The affirmative team also believes COVID-19 vaccine mandates on all public colleges and universities will enhance the general safety of the college community. Universities face an economic risk as the pandemic continues. The affirmative argues that through the usage of federal funding, risks and concerns for a student's well-being and financial situation is increased from the possibility of federal funding being taken away when the university becomes real. This is an issue because when funding is taken away from a college or university, aspects arise in order to replace the lost funding. Tuition increases, the potential for accepting more loans to pay off student costs increases, scholarships and more assistance offered to students becomes more competitive as less is offered for success in their pursuit of education. The federal government pays higher education institutions for research and development activities. In 2017, federal spending on major higher education programs totaled $3.98 trillion. This federal funding could be threatened with non-compliance with the COVID-19 vaccine mandate. The Biden administration called for all 17 million healthcare workers to be fully vaccinated by January 2022. This includes those working on college campuses. He also issued vaccine mandates for private employers with 100 workers or more. While these mandates guarantee protection for many individuals, it ignores the cost of COVID-19 testing on students. The University of Michigan is charging $50 per term coronavirus fee for full-time students and $25 per term for part-time. In many other institutions, if it is not included in the tuition, it is expected to come out of pocket from students. Should a mandate not occur, it would be in the federal government's interest that their investment in a federal contract becomes worthless if a university is under constant threat of infection or an outbreak at any given time. A site similar occurred last year when numerous colleges, businesses, and more needed federal aid through stimulus packages in order to afford to continue running. Should a college or university lose federal funding, who is to say they remain in operation at all? If the states are not willing to provide equal funding, they was lost through a failed federal contract from easily preventable conditions of accepting a college vaccine mandate. Higher vaccination rates on college campuses have led to higher quality of student life and education. The Annals of Internal Medicine shows that if a college can achieve a 90% vaccination rate, campus activities can be resumed safely while keeping COVID-19 cases below 5% of the population. First, higher vaccination rates lead to higher protection for campus communities and further our civil liberties rather than compromise them. While campuses house thousands of students, workers for all services are necessary, including teachers, bus drivers, food service, health clinicians, etc. Most of these workers are going home to families where the virus can continue to spread. During the fall 2020 semester, the University of Notre Dame had reported 13% of their entire enrollment tested positive for COVID-19. As of November 13th, 2021, with a 100% vaccination rate among students, Notre Dame has reported only 263 cases all semester. This semester, they have reinstilled most social events and returned to a stable status quo, enjoying many pre-pandemic activities. Second, universities that have implemented COVID-19 vaccine mandates for students have seen a positive response. According to Andrew Deichler, students generally want to get the COVID-19 vaccine as soon as possible. During the past year, many students have felt isolated and have not had a normal college experience. Moreover, Debbie Matthews, a lecturer of the University of Tennessee, believes that most students are open to getting the vaccine because of the lack of social interaction they have experienced in the last year. Ashley Duggar, Program Chair of HR Management for Western Governors University in Salt Lake City, believes that meeting and connecting with classmates and community members is important for students attending college. Third, higher vaccination rates can ensure a healthy semester and prevent a school shutdown and transfer online due to a campus outbreak. During the spring 2020 semester, over 1,300 colleges canceled in-person classes and moved online. The following fall 2020 semester, 44% of all universities had primarily online instruction, according to the College Crisis Initiative. A Washington State study found that typical students have trouble adapting to online courses. A Gallup student survey found 49% of students to believe the COVID-19 pandemic will negatively impact the ability to complete their degree. These statistics are concerning as enrollment of undergraduate students is down 6.5% from 2 years ago, clearly showing the impact and discouragement of the world around them. The COVID-19 vaccine mandate would prevent a move to learn online in order to keep students healthy, motivated, and optimistic for their futures. A COVID-19 vaccine mandate for all public colleges and universities would guarantee more than public health and safety on campuses. It would also provide students with the in-person community experiences that college campuses offer without the added anxiety and fear of their education and overall experience being taken away.
First negative speaker.
Can I type myself too, is that okay?
Yeah. Name?
Magdalena, no, sorry. All right. Resolved, all public colleges and universities should mandate the COVID-19 vaccine for all students and staff. We negate this resolution since mandating the COVID-19 vaccine violates personal choice, and the emerging COVID-19 virus mutations both have the possibility to undermine the vaccine and create a gray area regarding booster shots. I will go over 3 contentions today. First, that the COVID-19 rates are decreasing and therefore does not warrant a mandate. Secondly, that it is unclear whether the COVID-19 booster shot is required in this mandate. And third, that mandating the COVID-19 vaccine threatens the integrity of a school and job environment. My first contention is that COVID rates are decreasing. According to the CDC, COVID-19 rates are on the decline. From October 20th to 26th of this year, hospitalization rates had a minus 10.5% decrease over a 7-day period. Furthermore, 56% of the American public is vaccinated. People who want the vaccine are choosing willingly to get vaccinated at a steady rate. In order to beat COVID-19, we need to reach herd immunity, and the Mayo Clinic reported that about 70% of the population needs to be vaccinated or immune in order to achieve this herd immunity. The children's vaccine is going to be free to the public soon, potentially raising that number from 56% to 70%. Furthermore, without a mandate, a lot of university students have been willingly vaccinated. At the University of Wisconsin-Madison, the biggest public university in Wisconsin, it has 90% of its student body willingly vaccinated. We are close to reaching herd immunity in the United States, and schools still have the right to encourage and educate their students about getting a vaccine. People that want to get vaccinated will, and that number will steadily increasing, we will reach herd immunity without a mandate. My second contention is it is unclear whether or not booster shots should be mandated. With the emergence of the new Delta variant in the United Kingdom and 2 new variants out of South Africa and Brazil, the possibility of these variants undermining the current COVID-19 vaccine is up in the air. According to the BBC, it is, quote, expected that the Pfizer vaccine can combat the UK variant, but there is no certainty with the other variants as they are showing they are not as susceptible to the vaccine. With this research, how can colleges and universities possibly mandate a vaccine that may not work if these variants reach the US? Booster shots are also a point of contention since we do not know if universities will require booster shots as part of their mandate. The flu mutates each year, and the flu shot is a mere estimate of which strain is going to emerge as the most transmissible and occurring virus during that flu season. You can view flu shots as a booster. However, they are not required by universities. If colleges mandate the COVID-19 vaccine, will boosters be mandated? Will flu shots be mandated as well? I hope the affirmative can answer those questions for us. Our third contention is that mandating the COVID-19 vaccine challenges the integrity of a learning environment. Placing the responsibility on students who are merely trying to receive an education that will set them up for a career is irresponsible. There are less invasive measures available such as masks, social distancing, and regular testing. You can take off a mask after leaving campus, but you cannot, however, unvaccinate yourself. The affirmative may argue that choosing not to get vaccinated will result in requiring unvaccinated students to either stay online while the vaccinated get to enjoy a campus experience. This discrimination will significantly hinder students' college performance, as we have seen isolating students in front of a screen leads to depression and anxiety. Additionally, if the affirmative believes unvaccinated students should simply be unenrolled from whatever college or university they are attending, or if a staff member should be fired, this is the most extreme act of discrimination. A college and university environment is supposed to be a safe place for everyone to come and engage in academics. Threatening that environment just because of a vaccine will show that universities do not care about their students and staff. Student safety can be highly regarded without a vaccine mandate. It should be noted that public colleges and universities are higher education institutions that are more affordable and enroll a large, diverse group of people who either pay their way or want an education to help better their lives and well-being. With a mandate, public colleges and universities are saying they do not care about these students simply because they do not want to receive a vaccine they are either not confident in, do not support the making of, or any other personal choice. How can you rest someone's future career or passion because of a vaccine that only has one full FDA seal of approval? While we uphold the freedom for anyone who wants to get a COVID-19 vaccine to receive one, we strongly believe in the freedom to not be forced to get one. We are reaching the light at the end of the tunnel. People are willingly getting vaccinated, getting us closer to herd immunity by the day. Mandating this vaccine will either be undermined by mutations or will need boosters mandate this vaccine that will either be undermined by mutations or will be boosters is a violation of personal freedom, and we hope that you will vote for the negative on this matter. Thank you. Should we sit down for the crossfire or stand up? I don't know.
I don't care.
Probably stand over here, right?
I think we'll stand here. Okay.
All right, so you were saying that most colleges have 90% vaccination rate and that there's no need for a mandate, but there is, actually in Europe, there's a COVID surge, there's more Delta variants coming out, and in the UK, in the UK, the spread of the virus is blamed on schools, where the precautions such as like face masks, hand washing, which they're encouraging, has not been helping, even with the high vaccination rates, because of the new strains coming out, and with the borders opening, and the holidays coming in and more traveling, it is likely that in America we'll see a surge, as there's a surge in Europe at the moment.
So you're saying that there will not be a surge in
No, there will be a surge because of traveling. Everybody's coming from the holidays. International borders are now open. Canada borders are now open to the U.S. as of yesterday, and so because of the holidays coming up, it's going to increase. The vaccine mandate for college campuses is vital, especially for those that are going to be starting college in the winter semester who have not yet received the vaccine. It's not only a protection for the current students; it's a protection for future students as well.
Well, the Delta variant, you could still get COVID-19 even with especially the Delta variants. And like I said, there are variants coming out of South Africa and Brazil that, it's pretty sure that they will be not susceptible to the vaccine. So then you'll have a vaccine that will work.
Vaccines are being updated and researched every day. So even the booster is different than the shot that some of us got back in April. The shot's different, and the shot will be different next year, just like the flu shot's different every year.
Can I ask you a question?
Yeah.
What do you believe should happen to students that do not get a vaccine? Do you want them to go online or be simply unenrolled from school?
Can you answer that question?
Time is up.
Okay.
Second half speaker.
Sorry, what's your name?
Evan Ray, R-H-E-A. Ready if you want. Well, the negative argument before us stands whether or not colleges should adopt COVID-19 vaccine mandates. The affirmative side is that the willingness to act outweighs the risk in doing nothing to negate COVID-19, as we prefer to finally end this pandemic once and for all by proposing that all public colleges and universities should adopt COVID-19 mandates. The negative opposition used the argument that variants downplay the vaccines, that students should pay their way through instead of relying on federal funding. Now, in order to explain this, federal funding allocates money in order for students to have better online resources to use. Federal funding allocates money through FAFSA to allow students at a university to be able to participate. If a university is not allowed federal funding, they cannot provide federal FAFSA funding towards students. Along with bodily autonomy, I can tell you that as students, we all make choices to attend schools. Within that choice, we all share the same aspects present in our lives. We share the same dorms, classrooms, libraries, professors, and more. It is a choice to receive a vaccine. It is a choice to attend school. There's no threat to bodily autonomy when the threat of an outbreak can put our shared education in jeopardy, with the added threat of withdrawing federal contracts, which could give way to increasing costs that already weigh students down. The opposing argument is correlation between an argument against federal funding and arguments that variants will break out and make the vaccines useless. That is not the same as cause and effect. Vaccinated and you do not suffer symptoms. There's currently no study through the CDC that variants are currently affecting vaccines. Unvaccinated and you suffer symptoms, which can equal quarantining, hospitalization, and death of unprecedented and avoidable costs. There have been no studies to indicate that mandating vaccines within a college or university yield negative results, whereas through studies conducted by Yale University and the American Medical Association, if a concern towards COVID-19 is not taken, schools can suffer case numbers risen by an excruciating rate, as showcased by a current surge of COVID-19 in both Europe and the United Kingdom, where schools have been cited as the epicenters for infection due to a rollback of protection clauses. The potential for another surge within the United States is very real. In the last 4 weeks, the U.S. was averaging about 74,000 new infections per day amongst unvaccinated individuals. In the last 2 weeks, as reported by the CDC and Johns Hopkins Medical University, the U.S. now averages 83,000 cases per day. That's a 14% increase from a week ago and a 12% increase from before that. These cases negatively affect the unvaccinated, as vaccinated individuals obtain suppressed symptoms that keeps them safe from severity and hospitalization. With numbers comparable to last year, when November to January was this country's current peak, in cases equaling tens of thousands per day, do the pioneers of education in this country not have a responsibility to protect themselves and their communities? Our tuition, the school's federal funding, our education, and safety is at stake. And safety is not, in this country, is not a guarantee. It is a tool that we ourselves must employ, as we ourselves would be smart, gifted even, to not repeat the events of 2020. Federal funding ensures that schools and college campuses are able to operate efficiently without problem. Without federal funding, students such as you and I will not be able to attend school if we have issues with FAFSA, scholarships, or more, as federal funding provides money towards that. Close to herd immunity, the CDC says 90% of a community must be vaccinated. In an email sent from the UNT president himself, only 52% of the student population at this school is vaccinated. That still leaves a gap and does not fit the CDC qualifications of herd immunity. The opposition also only used specific schools in a handful of arguments, whereas there's 4,000 schools across the United States. How can they make such an argument when there's too many schools to certify with statistics that they didn't even provide a source to? If you have evidence to make such a statement, I request that you show it to me, because personally I do not believe that the majority of schools in the United States have currently fit the qualifications for herd immunity. There's $3.98 trillion for federal funding, and that is currently at threat of being taken away from schools if schools do not mandate vaccines. Currently only a 90% qualification rate is needed, whereas the majority of schools still fall under 60%. Audience, I ask you to raise your hand. Who in this room is vaccinated? Everyone? You all vaccinated? Okay, so there's about 3 people out of what, 10 in this room that are currently not vaccinated? Like I said, it's still a choice whether or not to attend school if you're unvaccinated or not. Without federal funding, how are you going to be able to do school through online resources or exemptions if there's no federal funding to help you out? For example, of how little of a threat this is in terms of herd immunity. Wait, I only have 9 seconds left. I can't bring up that point. Anyway, they also state that variants downplay the vaccines. There's currently no study that the vaccines are affected by variants.
Can we use 30 seconds of prep time?
They said we get like 2 minutes.
We get 2 minutes to divvy it up.
There you go.
That's 30 seconds. You keep going.
It's Nila Green.
Sorry, what was that?
Nila?
Ava, okay.
No, Nila.
Oh, okay.
Green, like the color. Okay. Can I go?
Yes.
Okay. The vaccine is not the problem with me and my teammates. The vaccine being mandated is the problem with me and my teammates. We have no contentions with the vaccine. If you want to get the vaccine, get the vaccine. Keywords, if you want to. Which over half of the U.S. population have already done so willingly, according to NPR.org, which states that 58.8% of the population is vaccinated. The CDC also just announced that Pfizer vaccine is now available for those ages 5 and up, and that would leave no doubt in my mind that with a bigger pool being able to receive the vaccine, that the numbers will go up, getting us to 90%, giving us herd immunity. They also keep saying that we should. That's also what they're saying, that if we want to. Okay. Oh, they said that they keep talking about securing federal funding. Well, is it about the money or is it about us? The federal people should care about us and what we want to do with our body, just like abortion is. My body is my choice. We don't want to put anybody at risk. We just feel like it's less invasive ways to not catch COVID, like masks, social distancing, and other things. I feel that also with the vaccine, you can still catch corona. So if you make everyone get the vaccine, everyone will feel comfortable enough to stop doing these things like having masks, wearing masks, social distancing, and we will be more likely to catch the vaccine anyways. Another thing is that, like the first speaker said, students are willingly getting the vaccine. That is our point exactly. If somebody wants to get the vaccine, they will do so if they want to anyway, so you don't have to force it. People who want the vaccine, like you said, when all of you raised your hands, they will get the vaccine. I personally don't want the vaccine, so I didn't get it. I still wear my mask and I still practice, and I still do less invasive measures to make sure that nobody else will get it. Another thing that they didn't answer is that, what do they want to do about the students who don't want to get the vaccine? What will we do? Will we not be able to go to school? You're saying that you're going to cut our federal funding just because we don't want to get the vaccine? I just don't feel like that's right. I feel like that's very discriminatory, and they also couldn't answer that. And then they said that us getting a vaccine will end the pandemic. How do we know that? There's always a different pandemic going on, from smallpox and measles. There's always a new disease coming on anyway. So how do we know that this vaccine will end the pandemic and that another one won't come? He also stated that there were no symptoms to the vaccine, which the vaccine actually on CDC.com has similar symptoms to corona anyways. Throughout your body, you get tiredness, headache, muscle pain, chills, fever, and nausea. So it's like getting the vaccine and getting corona has similar symptoms, but if once you catch corona, you can get antibodies and you won't get it again, and that's proven. Also, another thing that he said is that once you get the vaccine, you have suppressed symptoms, but it's also proven that people of our age group are less likely to get hospitalized and we are less at risk to get harmful symptoms anyway. So being at this age group and getting the vaccine is almost about the same thing, but the difference is we have the choice whether we want the vaccine or not. They also stated that they don't want to repeat 2020. Oh, they also stated to end the pandemic. Well, it is countries that ended the pandemic, and they did so not by taking off masks, not by already opening up the country when they seen that we weren't ready. They did so by completely shutting everything down whenever they seen that COVID was a problem in the first place. They didn't get to end the pandemic by opening back up stores, opening back up schools, and removing mask mandates, then turning around saying, here, get this vaccine, and we're going to end the pandemic this way. Countries that have done so, such as the Netherlands, and places like that, they did so when the pandemic first started, and they ended it now. They didn't go fully into the pandemic, then turn around and say, okay, take this vaccine, and now we're going to do this to end the pandemic. You can't work backwards. The milk is already spilled. You can't put it back in the cup. Thank you.
Okay, so crossfire now between the second sports.
You want to do it while standing up or sitting down?
Can you see each other?
Yeah, I can see it. All right. Ready?
Whenever y'all ready, I'll start this one.
All right. JAMA Medical Journal says that mask and testing alone is not enough to achieve herd immunity. Herd immunity needs at least 90% of the community in order to be immunized. You mentioned kids providing to herd immunity. How is a college campus personally affected by that?
We're just talking about, we never stated herd immunity just for college campuses. Y'all stated
No,
that.
but
We
you
just
said that
stated
herd immunity,
in
but you said that herd
general.
immunity provided through kids, that's enough to achieve herd
No, we're
immunity.
just saying that. We're just saying in general, just herd immunity for the.
But we're a
across
college
the
campus,
US.
we're a private community. We share the same classrooms. I don't see kids running through these halls.
I'm just saying, but when you go home, you're gonna probably be around kids. Like, we're just about to go home for Thanksgiving. Like, that stuff
Yes.
like that matters. So
Yes.
we're gonna get it. We didn't state it just for colleges. We're saying herd immunity in general.
Yes, so
Across
with,
the US,
so
yes.
with people going home for the holidays and visiting their kids, that has an increased chance of COVID-19 if those kids aren't immunized.
Yes, and that's another thing we're saying. So just like the vaccine, y'all say it will help, but like, it'll be more.
Because that's how
It'll
most
be
pandemics
better.
have ended, through vaccines.
No, the pandemic ended because they stopped it when it
The
started.
pandemic's not over. There's like 83,000 people
Okay,
still
but
being
there are
infected per
countries that
day.
have stated no more coronavirus cases. And
But
why did they
Europe
not
and
have
the
it? I
UK
didn't
are
have
currently
it.
going through
You can
research.
look it up. You can look it up. That they stopped.
So you
they
don't have the
didn't a
information on
pandemic.
hand right now.
I do. Hold on one second. I'll look it up.
I mean, polio, measles, SARS, MERS, those have been the main ways to end pandemics and turn them into an endemic.
I'm stating for this pandemic, the countries that have stated that they have no more
What
coronavirus
countries?
cases are countries.
You also said earlier, catch the vaccine.
North
You mean catch
Korea,
COVID.
New Zealand, Australia.
North
South
Korea
Korea.
as a source for not having
Italy,
COVID and
Pakistan.
full immunization.
From these countries they maintained strict protocols, shut their borders, brought in compulsory quarantine, and did everything possible to prevent the
You also
virus from
compared the
spreading.
vaccine to symptoms to COVID. Are you aware that the symptoms to a vaccine are usually eliminated within 15 minutes of receiving a vaccine? That's why they have you sit outside of.
Alright, third absent.
I'm so glad it's not.
Ready?
What's your name?
My name is Cameron. Ferty. Cameron Ferty.
I just need the first name, so.
Sweet. I'm ready. All right, sweet. So we believe there should be a vaccine mandate for all public colleges because a vaccine mandate protects the students and the faculty, and it ensures that federal funding for the university will not be cut. Now, just a quick run through of some of our arguments. We believe that this will protect the population among the community. They brought up how this age group is less, I guess, in danger of getting like worse symptoms of COVID. But when you go out into the union, you see a lot of different age groups. Like you see faculty, you see cleaning staff, you see people, just maybe their grandparents visiting their children or visiting students here, you know? So you can't really just cut it down to one age group that's affected. Plus, as Evan brought up, we are about to go into a holiday, going into Christmas, going into Thanksgiving. That's a big time surge that could happen. Like, I remember early 2020, and I was enrolled in these classes. I was enrolled in a film class I thought was really cool. I was enrolled in a psychology class, and I didn't feel like I got my money's worth out of those classes because after Thanksgiving break, everything shut down. We just kind of got credit for the class without really going into it, which is cool. I got the credit, but I also felt a little shorted in the way that I didn't get the full college experience, which is what we're trying to do here. They keep bringing up masks and social distancing, but honestly, I'm trying to reach a level of normality on campus. I don't want the new normal, I want normal, you know what I mean? And we can prolong it as long as we want and say we'll eventually reach herd immunity, but at 50% vaccination rate, that's gonna take forever. And I'm tired of wearing the mask. I'm tired of doing social distancing. I want to get the full college experience, go to the sporting events, meet in groups without having to worry about it. And when you're constantly under the threat of a shutdown or an outbreak, I just feel like you can never really fully invest in the education that you're getting. Like, had one of us gotten COVID before this debate, it would have really messed things up. We would have had to figure out Zoom or some other method of doing this, but most of us are vaccinated in here, and honestly, like, since I got the vaccination, I haven't really been worried about it. I haven't gotten sick or anything, and I feel like we are closer to reaching herd immunity now. And as far as their argument about most people getting it willingly, I mean, look around at UNT, like, we only have like less than 60% vaccinated here, and I feel like they push the vaccination here pretty hard. Like, nobody wants the testing, like that, to get tested every 2 weeks and get something jabbed up your nose sounds terrible. I was personally on the fence about the vaccine before I started at UNT, and that alone, I was like, yeah, I'm gonna get it. So even with that, there's still less than 60%, and they have to go through the hassle of submitting either their vaccine records over Canvas, or they have to go get tested. So I think that's no good. I think if you just get the vaccine maybe every year, then it cuts down a lot of hassle, and you can get it over with early in the semester and enjoy the rest of your semester and actually learn things. The pandemic is not over. I mean, even if cases are down currently, cases could always rise. Plus, we're still in a pandemic mindset where, like, I mean, a lot of my classes have met up on Zoom. The mask, again, I'll reiterate that. Like, we're still kind of enforced on the mask. Let's see, they brought up the booster shots, which, I mean, that's kind of irrelevant in this because, like they said, we haven't really talked about the booster shots as part of the COVID vaccine. So far, I'm gonna go ahead and use the requirements for like going to concerts and stuff, just 2 vaccines. You need the 2 vaccines, and then you're considered vaccinated. So we're not even gonna talk about booster shots. Plus the personal choice argument, I feel like is kind of irrelevant too, because it's like, they brought up the my body, my choice thing, which kind of, it makes sense, but when you really think about it, it's not a my body, my choice issue. It's because you still do have the choice. Because you choose if you want to go to college or not. And even if you don't want to get the vaccine, there's other arrangements you can do. You can go to a different campus, a private college. You can go to, you can get online schooling. You can wait it out. That's all a choice. So yeah, that's what I got.
Okay, there, next.
Hi, my name is Maria, and I'm the 3rd speaker. Oh, can I turn myself as well? Thanks. So he starts stating about how if you're not vaccinated, people shouldn't come to school, or there's different options. So you are trying to tell me that students that aren't vaccinated should be discriminated due to their beliefs. So if somebody isn't vaccinated but invested money into coming to school, they shouldn't have the choice to come here when, you know, wearing a mask is effective. And like you said, we are still enforced to wear masks. That's what you said. So I believe if somebody that isn't vaccinated and wants to come to school should wear a mask, just like most of us in this room that are vaccinated, like the previous team member requested, you know, if we're vaccinated to raise our hands. Mostly everybody in this room is vaccinated and is still willingly wearing a mask because we know a mask can keep us safe. So there's evidence that natural immunity could fall and render people to the infection. So over a year and a half now, clinical experience of observant patients who were infected, and our natural immunity is going strong, and that's because our natural immunity in the body develops antibodies to entire surface the virus, not just the spike protein constructed from the vaccine. From U.S. News Source, from Dr. McCary in 2021, the power of natural immunity was recently affirmed in a study which found that 6.7 times greater levels of protection among those with the natural immunity versus those vaccinated with the vaccinated immunity. One study conducted by the state of California this spring found that 38% of Californians and 45% of people in Los Angeles had conserved already natural immunity, which has decreased the cases in California as well. And we also start talking about how it is our choice in our body. COVID-19 is not completely cured once we get vaccinated. There's still a chance that you can get COVID once you are vaccinated still. So why don't we, do what we can do, stay socially distanced, not force people to get a vaccine because we can't force that upon somebody. Just like, you wouldn't like to be forced to do something with your body. So public colleges shouldn't require a vaccine. The CDC and COVID-19 rates have declined from October 20th to the 26th. Hospitalization rates have gone down as well over 7-day periods, and 56% of Americans in the public are already vaccinated. So once, in order for us to beat COVID-19, we need to reach herd immunity, and that is about 70% of the people need to be vaccinated. So once, we are all vaccinated, and like you said, kids are vaccinated as well, not a lot of people will be catching COVID. And when we go to like our Christmas stuff and we go out with our family, we won't be as sustainable to catch COVID because kids are also less likely to catch COVID. According to Dr. Carey, we can see that the risk of kids in the age of 5 to 17 is 0.3 per million of kids to get COVID-19. So we can't really say that with many like adults willingly getting vaccinated and kids being so less likely to catch COVID, and people already in our age group wanting to get vaccinated, it will be less likely for one of us, or with such many already people vaccinated, we won't be catching COVID as easily. And wearing your mask, staying socially distanced. If you are scared for your life and scared to catch COVID, then you shouldn't be going out. That's your natural choice. You're not required to go and visit your family if you feel like you are not safe. That's all I have to say.
Good.
And Crossfire.
Okay.
Can I ask a question really quick?
Depends.
Interesting. I heard, so your third speaker mentioned that, students can go to private colleges if, they can't go to the public college. I went to a private college for 2 years and I'm $60K in debt from 2 years. Private colleges are incredibly expensive, and putting students in a position where they have to take out that much debt
Is this a question or a summarization?
Well, I'm asking if you knew how
Here's the
expensive private
thing.
colleges are.
If federal funding is cut, then this will be just as expensive as a private college, so.
Do you think that some colleges might cut federal funding if there is a vaccine mandate?
I don't understand the question.
Like some colleges might disagree with the choice to force their students to get a vaccine, so they
Yeah,
draw their own funding.
if a school chooses to,
Then go to those colleges.
yeah, if a school chooses to not enforce a vaccination mandate, then they forego federal funding. Yeah, one of your speakers, the summary speaker, mentioned Dr. McCary. What are her credentials?
I have a question. What is normal? Because you said you want to get back to normal, so what is normal? Because normal is very subjective. Because you can be the lady, you can be the, what's not normal about now? You walk around all
You're wearing a blue shield on your face.
Yeah,
That's
what
kinda-
if I like that? I could be,
Then
on
what?
Snapchat. Yeah, that's what I'm saying. So what is normal? Because I could like this.
I would say
And then another
2017,
thing,
2018 was
I think
pretty
another
normal.
problem is you said you got the vaccine,
Yeah.
and then so now you feel like you don't have to do any safety protocols.
Yes.
That's the problem. Like that's gonna be a problem because you
That's
can
how you
still
build
catch
herd
COVID.
immunity.
You
When you're
still catch-
vaccinated, you no longer have to
No,
worry
but
about
that's
safety
still, you can still
protocols.
catch
If enough of the
COVID.
community is
That's what I'm scared
vaccinated,
about.
if enough of the
That people
community is
are gonna
vaccinated,
get the
then you
vaccine
don't
and
have
just
to
think,
worry
oh
about
my gosh,
COVID-19
COVID's over
anymore.
when it's not. That's not the case, and it's been proven that you can still catch
Here's the
COVID
thing.
with the vaccine.
You
But
can
you
catch
went
a
back to
flu
living
now.
like normal, but it's not normal.
Yeah,
You
but
still need to take safety protocols.
So y'all were saying that if you already have to
contracted COVID, they don't get the vaccine because you built up antibodies. There's actually no proven research that the antibodies stay in your system after 3 to 4 months.
Yeah, and they also
So
said that
I
the
wanna know-
vaccine only lasts up to 6 months. So it's about the
Yeah.
same time.
Yeah, that's essentially, well, hold on, the natural immunity time is 4 months, while vaccine is 6 months. That's how vaccinations work.
Yeah, so it's like it's about the same. Is it not? You get
No,
4
4 months
but
is,
it's 4
4
months, but
months is
I don't
different
wanna
from
get the
6
vaccine.
months.
Yeah, but I don't want to get the vaccine, but we're still gonna
Also,
both
your summary
have the same-
your summary
we're both
speaker
gonna have the same.
mentioned that cases are going down, whereas cases are averaging 83,000 cases a day. That's a 14% increase from a week ago. How do you respond to that?
Well, hospitalization rates are going down, which is more.
88% of hospitalizations regarding COVID patients are unvaccinated individuals.
Well, that's their choice.
It's their choice to go into the hospital?
Well, it's their choice to not get vaccinated.
Let
and
us
know the risks of
let us have a
the
reminder
virus.
here. COVID-19 does not care whether or not you're vaccinated. If you're vaccinated, you don't suffer symptoms. You don't suffer
Exactly.
hospitalization. Even your
Exactly.
negative speaker agrees with me.
COVID
If
does
you're-
not care if you're vaccinated. Exactly.
However,
exactly
when you're
what I mean.
vaccinated,
That's
you
exactly
don't
what I
suffer
mean.
the symptoms of COVID. Wait, it's been 3 minutes already.
Okay, fourth F.
Okay, my name is Amy Zamora.
Whenever you're ready.
Judge, the affirmative team believes that public colleges and universities should mandate COVID-19 vaccines. While the human health side of it, of course, is the most important to the affirmative, there is an economic risk for public colleges and universities as well. That has been overlooked throughout this pandemic. According to Daniel Payne, a writer for Politico, an official at the University of Arizona expressed that university officials worry that college enrollment and tuition dollars are at risk the longer the pandemic continues. Should another shutdown occur due to an outbreak, the affirmative team has explained how the loss of federal funding would impact certain programs within these institutions, such as research and development activities. This could be one of the many effects of not mandating a COVID-19 vaccine within colleges and universities. Moreover, with the loss of federal funding, students would be burdened with the increase in costs in areas such as tuition and other college expenses. I believe that the affirmative team has won this debate because we have argued how the absence of a mandate would leave colleges and universities in a vulnerable state because of the threat they face of another COVID-19 outbreak. My teammates have explained how mandates for public health workers and private employers have guaranteed protection for those individuals under the Biden administration. Implementing a similar mandate for public colleges and universities would guarantee protection for students and would secure funding for universities and colleges as well. Respectively, as I mentioned before, the human health side is the most important to the affirmative. Therefore, we believe that a vaccine mandate on all public colleges and universities will enhance the general safety of the college community. The affirmative team has discussed throughout this debate how a mandate would not only secure federal funding, but it would also warrant that students and professors would be returning to campus for their safety and public health is not compromised. Moreover, we have provided evidence that supports our arguments. Universities who have implemented COVID vaccine mandates have seen a positive response from students. This is most likely because of the normal college experience that they have been deprived of during the shutdown, and because students care about their overall health. For example, students from Ohio State, where 89.8% of students and staff have received the vaccine, have seen a low positivity rate, further supporting our argument that a vaccine mandate would enhance the community's general safety. According to the Washington Post, more community colleges in Maryland are mandating the COVID-19 vaccine, and those who have not implemented it are encouraging their students to get vaccinated. And one of the reasons for this is because these schools were greatly impacted by enrollment drops during the pandemic. The negative stated that you can remove a mask, but you cannot unvaccinate yourself. But face mask overrulings in schools were overturned recently after the legality of it was evaluated and found that the ruling itself was in violation of the Americans with Disabilities Act. So while students may wear a mask, there are those who choose not to. And who's to say that those who choose not to wear a mask are amongst the unvaccinated, therefore increasing the risk of transmission among students. Moreover, one of our opponents' contentions was that COVID rates are decreasing, but as reported by the CDC COVID data tracker, colleges and universities still report an average of about 200 to 300 COVID cases a week, except at universities with a 90% or higher vaccination rate, with extensive required testing and proper quarantining. Davis Jenkins, a senior research scholar with the Community College Research Center at Teachers College of Columbia University, stated that after suffering steep enrollment declines during the pandemic, community colleges are eager to sign up more students and generally want everyone to be safe when they return to campus. This statement made by Jenkins sums up both of the arguments that the affirmative has made. Judge, the affirmative team has won this debate because we have given a thorough argument as to why public colleges and universities should mandate COVID-19 vaccines that have been supported with evidence. Thank you.
Okay, next.
I believe that the negative has won this debate because we have demonstrated how choice is a fundamental right for students. We are for the vaccine for those that willingly want to take it. Like we stated before, the COVID rates are declining enough to mandate in colleges. Does not make any logical sense. They said that the COVID rates are increasing, but not compared to the height pandemic time of last summer and last fall, they are indeed decreasing. And while our opponents have not answered whether or not students will be unenrolled or forced into online classes. If the universities truly cared about their students' health, safety, and happiness, they would not require a mandate and instead focus on less invasive measures. A vaccine should not be a free pass to return to normal. The affirmative believes a vaccine is a free pass to do the things we used to do, and we think it is still dangerous since you can still contract the virus even with the vaccine. Like I said, the BBC reported that the UK chief scientific advisor said that the new variants pose a threat to the vaccine's effectiveness. That means that students may be forced to get a vaccine that might not work in 6 months and does not make them completely immune to the virus. The affirmative said, my teammates and I have shown that a mandate would be destructive to students and future leaders of this country. So let me get to the core of this argument. The decision is you either get a vaccine or you are not allowed to go to school. Or you are allowed to be forced in an online environment that could increase your depression and anxiety. And that's a hard decision. You could be put in a compromising dilemma that risks your future and well-being. You can play politics all day and argue, but at the end of the day, it should be your choice to choose what goes in your body and how effective it can be in the future. Therefore, we ask that you vote for choice, vote for less invasive safety measures, and vote for students' education.
Good job. I don't know, shake hands or something. Usually after debates,
So
everyone
It's
shake hands
one
or
thing we
fist bump
can't
or something. I don't know, we're all friends.
Yeah.